was also devastating because had one of those doctors over the course of those 2 years listened to me when I said where I worked and had listened to me when I questioned its being potentially zoonotic and had one doctor run the titers to see that I had Lyme, I could have gone on treatment earlier. Welcome, either back or just welcome to the channel. So if you're new here, then you probably noticed that the majority of the videos that I currently have uploaded are compilation videos from Dead by Daylight. I stream on Twitch, that's why. But what you might not know is that prior to this channel has actually been existing since 2017. And before, it was almost 100% all about Lyme disease. Now that being said, the videos weren't very well edited. On top of that, I wasn't really taking the time that I should have to convey the messages that were kind of important. And with that, I decided to cut down all those videos, like 90 of them. All right, so let's get into it. All right, so let's start with 2015. 2015 was probably the worst year of my life. I was working at New York City Animal Shelter, running a kitten program, which I loved what I was accomplishing. The job was a wee bit stressful. So moving on, it was also a really bad year because I broke up with my ex of 5 years and he didn't move out until the beginning of the following year. So that was terrible. Don't do that ever. On top of that, the year prior, my mom passed away, and it really didn't hit me until the breakup happened, and yeah, so it was just a crappy year in general, but there was something else that was off. I wasn't feeling as good. Now, when I say that I was working at the animal shelter, I don't just mean I was working with kittens, although that was my primary job. I was also working with wildlife, deer, all sorts of animals in all 5 boroughs of the city, and I also volunteered at the Wild Bird Fund, which is a rehabilitation center for wildlife. Sorry about that. So yeah, so 2016, I got the joy of starting to date the person who would be my future husband. And on our first official technical date, he had a bit of a cold. And he warned me about it, but we drank a little bit and we went to go see a movie, and I just couldn't help it. I wanted to make out with his face, so he got me very sick. When I say very sick, I mean I was down and out for pretty much the majority of a month. I was just, But because I'd had so many upper respiratory infections in 2015, one of which I actually went to the doctor for, found out it was bacterial bronchitis, and I went on Z-Pak and whatever, and he also told me I had asthma, which was interesting. But with this one, I was physically too tired to transport myself to the urgent care to actually check any of it out. So I just wrote it out. I was able to return to work within about 2 weeks, but I was still feeling the side effects of it for quite a while. So then about a month later, I get my first yeast infection. Fun thing to talk about, especially since a lot of my viewers are men. Anyway, yeah, I got a candida infection, and I'd never had one before. I was 27, 28, I don't know. But I'd never had one before. I obviously went immediately to urgent care because I'm like, my body's like being weird. And not only did they do that, but they also got me medications for that, but they also got me to pee in a cup, probably to check for pregnancy, to which they found blood and bacteria. It tested positive for bacteria, so they were like, you have a UTI. We're gonna put you on a broad spectrum antibiotic. We're gonna give you the medication for the other problem. And I'm like, okay, great. And then I'm like, actually, my throat's kind of sore. Can you take a look at it? So they look at my throat and they're like, oh, it looks like you have strep. So they do a rapid strep test. It actually comes back negative, but they say that the broad spectrum will actually cover that. They're gonna send out the culture. I find out later it was a strep B infection, which is kind of weird. Not a very common thing. Just so you know, there's strep A and strep B. An actual strep throat is strep A. I'm not gonna go into all the science of this, but anyway, it was weird, but whatever. Now, here's the interesting thing. I take the medications, everything gets better, right? A month later, I get one infection, and then the other, and then the other. So even though they told me I had a UTI the first time, but I had no symptoms of it, like I didn't have any issues peeing or anything like that, but they're like, oh, you got a UTI. Now this time around, I did feel it. I did have problems. So head back over to urgent care, get refills for all the prescriptions, do it again. This happens 4 months in a row. Every month. A few weeks after symptoms go away, they all come back, and they come back harder and harder each time. This is the point where I decided, you know what, I need to actually go see my general practitioner. So here we are. It's now summer of 2016. I've been having these frequent infections for the past 4 months-ish. And in turn, I've also got another surprise. My period just decides to YOLO, disappear. Be like, hey beach, I'm out. So I go to my general practitioner. Obviously she says follow up with your gynecologist in regards to the candida and also the birth control. Or not birth control, exactly. That was what I got. I'm sorry, did I mention I have Lyme disease? It causes issue with memory. Whatever. The point is, for the missing period, go to the gynecologist. She also suggested that I go to a urologist, not back to the clinics that I've been going to. She says, I want you to actually go see a urologist. I'm like, okay. And I do. There was a day I went to work. I couldn't urinate. Barely at all. And the pain was pretty bad. It was pretty up there. I've had worse pain thus since, but it was definitely not great. So by the time I get to the general practitioner, she's like, all right, I'm giving you a referral for a hematologist. I'm giving you a referral for the urologist, but you gotta go to the urologist right now. Like, I don't know what's wrong with you, but you just need to go. Because I just can't pee. Like, it's just nothing is really happening except for small amounts of blood. So I walked, because I was living in the city, I walked from the one doctor, the GP, to the urologist. I was actually able to go to the bathroom by the time I got there, and it was a cup of straight blood called gross hematuria. Anyway, this urologist decides to tell me, and I did bring up, just so you know, I did bring up that I was also bruising. I brought up the other infections I was having. He said that what the clinic had originally done was wrong. They should not have given me antibiotics without taking a culture of the bacteria to actually see what strain of bacteria was causing these UTIs so that I could have the appropriate medication. So he said, you're constantly just being treated with these broad spectrum antibiotics, and therefore you're just making it worse. I'm like, okay. So now he has my urine, he tests it, he says, well, there is bacteria there, and gives me a prescription for antibiotics. When I bring up the point that you are giving me a prescription again for antibiotics without taking a culture, why? Now here's the funny thing. The test results from both the clinics, urgent cares, and this doctor all came back negative for bacteria. So it tested positive for blood, and it tested positive for white blood cell count, which is a sign of infection, but there was no bacteria causing any of this. That's fun. So I asked him why this would be, and he didn't reply. So we're doing great here so far, right? Keeping up with me? Okay, so the next doctor I went to, gynecologist. I go to her, I explain to her what the symptoms are, what is going on. She's worried that I have PCOS, which is polycystic ovarian syndrome, I believe. I hope I said that right. So we take a look inside for the potential cystic part, and we don't see any. So she then says, well, it could potentially be POF, which is premature ovarian failure. We're kind of like going through menopause early. That's great news. I mean, to hear in the peak of your childbearing years. But let's keep moving forward. She gives me more medications, different medications for the frequent candida infections. And also puts me on birth control. This will help regulate my period. This will make it that I have a period, which will also help maintain the health of my reproductive box until we can figure out what's actually going on. So then, the next doctor, the hematologist. Now the hematologist was actually, the first one I went to was a dick. I now had some information from the gynecologist, the urologist, and the general practitioner. I was now taking that with a list of my symptoms and also test results from the clinics and so forth and so forth. And I'm like, tell me why I'm bruising and what's wrong with me. And I leave being told I probably have a low iron count and to take iron supplements. And mind you, he did this before getting the blood results back. So, yeah. Was just told, take an iron pill. And I'm like, okay, you're a doctor, I'm gonna do what you tell me to do. I don't know. So now I go back to the general practitioner and I'm like, well, I kind of got dismissed by everyone so far, and here's where we're at. And she says, maybe it's depression. And I bring up a point of saying, well, 2015 was really freaking bad. It was a bad year. This year I've been, more maintaining my work-life balance. I'm in a happy relationship with my partner. And yes, my job is stressful, but it's no more stressful than any other job that I previously had. And yeah, I think I know what I am like when I'm depressed, and this isn't it. And she tries to put me on an antidepressant, even with me saying I'm certain it's not depression. So here we are, now it's fall of 2016, and the symptoms are not getting any better. They're actually getting a little bit worse. And I don't know, I just start to let the idea that these doctors who are saying maybe it's stress or depression, what if they're right? And I don't have, because I'm working full time and I'm salaried, which essentially just was a bullshit way of saying you work 24/7. I don't have access to going to the doctor as much as I need to, and maybe I need to take some time off. So I make a decision with HR to take a medical leave of absence for, I think it was like 6 weeks that we did. We were planning on 4 and did it up to 6 or something. Not 100% sure. But anyway, we decided to take the medical leave of absence, and during that time I'm like, let me follow up with another hematologist because I think that first one was bullshit. Now this hematologist, I actually really respected. It was one of the few doctors that up until this point had been at least kind to me. She really listened to everything I said, and I brought up an idea of maybe it's zoonotic. Like, I'm working with all this wildlife, I'm working with all these animals, I'm coming into contact with sick animals constantly on a daily basis. What if it's something that could have been transmitted? Now, the only thing that we could think of to test at the time was Bartonella, which I was familiar with because that's also better known as cat scratch fever. And, did I mention that I work with kittens and they're just basically fluff balls with razors? So we test for all of that, and nothing shows up at my blood work. She's like, I can't find any abnormalities. She's like, but I can tell there's something wrong. Like, I can see what you're going through and it's weird, which is odd to hear from a doctor, but I actually appreciated it. And she says, let me refer you to a rheumatologist and an immunologist. Because she's like, I don't know exactly which direction we're going in here with what's wrong with you, but let's just send you to both. And she's like, please follow up with me once you find out what's wrong. So, yeah. Oh, wait, let me add the next one. Also, she noticed that I had a very high pulse rate, and she noticed on all the paperwork that I was bringing from all the other doctors that my heart rate was at its lowest around 90 and usually around 115 to 120. She's like, I think you should also see a cardiologist. So the first one I did go to was the cardiologist out of all of them. Now, I had to go get a physical exam, then I had to wear a kind of like a scanner thing. Like, I had all these little like stickies around my heart. And I had to wear a monitor, I had to wear it throughout the night. I think I had to wear it for a total of 24 hours, and then I had to bring the test thing back in. And then I had to do a running test and all of that. I was diagnosed, based off of that, I was diagnosed with POTS, which is geez, this is why I take notes. I don't even know what I'm diagnosed with. Whoa. Postural orthostatic tachycardia syndrome. Now, because I haven't been going into too much detail with all of my symptoms, this would explain my temperature intolerance, why I can't get up too fast, why I was getting a little lightheaded. And then also he did a couple different like tests and said that I may have peripheral artery disease, which would explain why like I was having pain when I was walking up the stairs and so forth. So yeah. So it's winter 2016. I am off work right now on a medical leave. I have already seen everything previously spoken about. My symptoms are now getting much, much worse rapidly. First thing I've noticed is the fatigue that I was kind of having is now like fatigue. And in that I got a fat. I gained 10 pounds rapidly, and all in my abdominal area. It was kind of weird. But at the end of the day, 10 pounds is vanity. Mind you, I had started off this health journey at around 150 pounds, which if that sounds like a lot to you, suck it. It's not, because I was 150 pounds with a decent amount of muscle on me. I was doing very physically-ish stuff at the shelter, and even still, you know, I lived in the city, I was walking a lot, so yeah, I was quite happy with being that way. So now I'm up about 10 pounds, which, you know, would be considered I gained some vanity weight, which, you know, nobody wants, but at the end of the day, it's not the worst. So, I've also noticed that even though gaining weight, I'm losing my appetite significantly, and it's almost hard to eat. I'm also getting sore in areas that I'm not used to. I mean, I generally have dealt with, you know, back pain or whatnot, things that just come with age. I'm not that old, but you know, it can happen. But yeah, so now I actually get to go and see, during this time, the rheumatologist. That was the first one. So I brought every single test result now. I brought the paperwork from the urologist, cardiologist, gynecologist, general practitioner, urgent cares, everything that I had, oh, and the hematologist, I bring it all to the rheumatologist. And let's break it down. He's confused as to why the hematologist suggested I go to him. And I'm like, I don't know. I don't even know what a rheumatological disease is, but I'm here, so could we just take a look? One of the tests he does is it's a specific spot check, and he's like, the places that you feel pain, I think are a sign that you're developing fibromyalgia. And I'm like, oh my God, I've heard that's bad. Does that explain any of the other things going on? And he's like, no. And I'm like, okay, well then. And I'm like, how do I manage this new pain / fibromyalgia? And he's like, right now with aspirin. And I'm like, this is going great. Had to take a short break because the camera decided to overheat. But moving on. Okay, so the rheumatologist has basically wrapped it up by saying potentially got fibromyalgia, treated with some ibuprofen. If something rheumatological continues, come back. Which wasn't exceptionally helpful. And you may also realize that a lot of these cases, I'm getting diagnoses where it's like, well, this could be what you were developing. And you might ask, why didn't I go back or follow up, get a second opinion on those specific diagnoses? And because regardless, I went home, I did my own research, none of them were answering what originally brought me in to the doctor. And that was this cycle of chronic infections that I was having. If any of those actual diagnoses, is it diagnoses? Diagnoses? I don't know. If any of them had actually answered what I was looking for, then I would have done it, but they weren't. So next was the immunologist. This one was a super fun one. She did such a great job with me. I Again, now loaded with everything the rheumatologist, hematologist, cardiologist, urologist, gynecologist, general practitioner added, plus also the urgent cares. All the information that I had gotten from them, I brought all this information to her, to which she just, I was so, the level of being dismissed with this doctor was so profound that I don't even entirely remember what happened, but let me break it down for you. So this immunologist also works with the study of allergies and your immune system for that. So I'm thinking, I have a really shitty apartment and there's kind of like some mold in places. Maybe I'm allergic to mold or something, whatever. Because I'm like, I just don't care. I don't know. There's got to be an answer. It's got to be something. So she's like, all right, fine. We're just going to do some allergy tests. We'll just do a basic panel. I'm like, okay, great. So the way to do this is by taking a toothpick and scratching your skin a little bit with each thing and then seeing which one reacts. But I tell her, oh, just so you know, I kind of have really sensitive skin. This was something that I've always kind of had it, but it was getting definitely worse. If you touch me, it burns and that spot hurts in a weird sensation way. It gets very red and inflamed, and I can do what is known as skin writing. So she takes the toothpick without any of the allergens on, scratches me, sees it rise up, and she's like, okay, yeah, we can't test you this way. We're gonna have to do blood work to do this. I'm like, okay, great. She's like, just so you know, that's dermatographia. And I'm like, oh, what's that? And she's like, your immune system is basically just, overreacting. I'm like, oh, well, does that explain everything else? And she's like, oh no. She's like, just take an allergy med for it. So I don't follow up with this doctor because, again, I get my test results through my patient portal. This was, I think, a Mount Sinai doctor. Oh yeah, don't go to Mount Sinai, sorry. And nothing came back with anything, essentially. Couldn't find any allergies to anything except for the fact that I'm allergic to nothing. That's the way I describe dermatographia. I have an irritating way of being allergic to nothingness. It's great, especially in the heat. All right. Winter is almost coming to an end-ish. It's like January, and I am returning back to work. I think that story of what happened should be its own separate story time, but let me just sum it up of, went back to work on a Monday, quit work on a Tuesday. Yeah, I'll go into more detail with that in another story. So now springtime has happened. I've seen all these doctors. I do not currently have insurance. That's great. And my weight has gone up again, an additional 10 pounds. And once again, only really in my abdominal area. I'm starting to look pregnant, but I'm not. I'm not pregnant. Just, yeah, sorry, gave away that, but yeah, wasn't pregnant. The other things that are happening is I'm having a harder time sleeping, but I'm needing to rest a ton. My muscles are really weak at this point. And again, I'm continuing to have no appetite. I end up getting another infection, and this time, because I know I don't want to go back to that general practitioner, and I really haven't spent time looking into one, plus I have no health insurance, so I'm like, I'm just gonna go to an urgent care. So I go to urgent care, get some medications for the infections, and he ended up feeling my thyroid, and he's like, your thyroid feels firm. And he's like, have you been experiencing any, weight issues? To which I'm just like, somebody noticed. And I'm like, yes, I've been rapidly gaining weight. I don't know why I have no appetite. And he's like, you know what? It might not be your fault that you're gaining weight. You might have a thyroid issue. You should go see an endocrinologist. Well, during this time, spring 2017, Chris and I got married. We got married at City Hall. We were planning on having a wedding because his family really wanted one. Also, let me just sum that up real quick. We ended up having that wedding too, just a year later. But we did it now because I needed that health insurance. So once I had it, I decided, all right, let me find a new primary care doctor. And I decided, I was gonna stick with a woman because I just believed that there was a greater chance that I would be treated, equally. So I go to the new primary and oh my God, she is fascinated by my case. I brought all the paperwork from the hematologist, rheumatologist, immunologist, cardiologist, and gynecologist, plus the previous primary care physician and the urgent cares. I bring all the information and all the test results I have, everything, give it to her. I'm like, fix me.